Independent RX Forum is sponsored by Wellgistics Health. Welcome to Independent RX Forum with the National Community Pharmacists Association, America's leading advocate and business education provider for independent community pharmacists. Independent RX Forum is powered by RX Connection.
Hello and welcome to Independent RX Forum. I'm your host, John Beckner, and I'm joined by my friend and co-host, Ed Cohen. Ed, welcome.
Well, John, it's great to be here with you today, and I look forward to another robust discussion about the future of pharmacy practice.
So to remind our viewers and listeners, we are live streaming from the NCPA annual meeting in Columbus, Ohio. This is day 2 of our live streaming podcast, and we appreciate everyone who has tuned in today. We're really excited about our upcoming topic, which is going to be LTC pharmacy at home, and we've got 2 experts in the field to share their insights on that particular topic. We have Susan Rhodus, who is Senior Vice President of Contracting and Advocacy for GeriMed. Welcome, Susan.
Thank you very much.
And then we have Leanne Haley-Brown, CPESN Pharmacy Lead for LTC Pharmacy at Home.
Thanks, John. Happy to be here. Thanks, Ed.
Yeah, really glad you're here. So let's dive right in and talk about what we mean by LTC pharmacy at home. What does that encompass?
So long-term care pharmacy home is a class of trade where we've got patients who want to be in their homes. They want to age in their homes, where they can be having the medication is going to be taken care of by their pharmacy. They need compliance packaging so their medication can be managed. And then they actually require delivery because they have mobility issues and they're not able to go out into the universal home. So our pharmacies are uniquely situated in our communities to be able to care for these patients.
And to add to that, long-term care pharmacy at home is seen as someone who needs institutional type setting services from their pharmacy, even though they're not in their own home. It should not matter where that patient is, whether they're in a nursing home, assisted living, group home, or in their own home. It doesn't really matter. It depends on the patient. It depends on what their needs are. And if they need this care, as Leanne stated, somebody who has trouble leaving their home on their own, they can't drive, somebody who needs to make sure that their medications are packaged correctly. Usually you're talking about elderly people or disabled people who really need this care to make sure they're taking their drugs correctly.
So the concept of LTC pharmacy at home is relatively new, correct? Is that
Not really
accurate?
It's not really, right, Susan?
Correct.
This has been around for quite a while, but unfortunately, and maybe fortunately, what we're seeing is we've had a generational explosion now of patients who are going to need to age in their homes because there frankly are not enough facilities to be able to care for them. So this is a place where pharmacy is uniquely situated to be able to address what is going to be a public health crisis in the next several years. I know in some of your presentations, you have a great slide that talks about the impending mountain.
Yes, so the most people over the age of 80 will happen in the year 2040. So what are we going to do with all these people? There's only 1.3 million beds for nursing home. There's about 1 million beds of assisted living, which costs a lot of money. Most people can't afford. You're talking a minimum of $36,000 a year to stay in assisted living. There's a lot of people who are retired cannot afford that. So it makes sense for them to be in their home versus being having to go somewhere else or not being able to be taken care of at all. And a lot of these people don't have family members around to take care of them on an everyday basis, or they have a caregiver like a home health care agency that's coming in to assist them. And if they're taking a lot of drugs, most of these patients are taking more multiple medications. A lot of them are taking 4, 6 to 10 medications a day. And to keep track of that and know what you're taking correctly is just way more than they can handle. One of the number one reasons people go to the hospital is medications.
Yeah.
And there's a study out there from 2018 that showed it was about $527 billion a year in healthcare dollars we spend because of wrong medications or wrong prescribing or the patient taking them incorrectly. as we all learned in pharmacy school, right patient, right dose, right time, right drug, period. So those things are really important in this population so that they're not going back to the hospital, they're not going to a nursing home, and they're not going to the ER, because that costs the healthcare system way more dollars. So that $527 billion a year is about 16% of our total healthcare dollars. That's a lot of money.
Huge amount.
Wasted. And it's literally wasted. So if pharmacists can step up and become the care coordinator and the person taking care of these patients and allowing them to stay in their home longer, we're going to save healthcare dollars.
So, and I'll pose this question to both of you. What are the challenges and impediments to more pharmacists getting involved in this space?
I think some of the challenges and impediments are, frankly, a lack of understanding around how this patient-centered portion of care can really be transformational for your pharmacy practice, as well as, getting you reimbursed for the services and the clinical things that you need to do to care for these patients. I think that's a challenge. I think that there are a lot of organizations in the industry. We're trying to message this as much as we can as being an opportunity. My fear, frankly, is that if independent pharmacy doesn't embrace this model, that there's going to be someone else out there in the universe that's going to say, there's money here, not necessarily thinking about the patients first. Like, we know independent pharmacies uniquely situated where we put our patients over profits.
Of course.
I don't want an organization to come in that does profits over patients and gather these patients and take them away from our pharmacies. What would you say about that, Susan?
I mean, I totally agree. I think taking care of these people is so important, and independent pharmacists are uniquely poised to be able to do this. I think having them understand all the pieces. CMS has 10 criteria, 8 of the 10 apply to this piece of the business, and making sure they understand what they have to do to qualify as a long-term care pharmacy is an important piece that a lot of them don't understand.
Let's go into that. That was actually going to be my next question, and a very good segue is help us understand the regulatory environment there.
So if you talk about someone who belongs to a long-term care network and is able to get paid at a different rate than what you get for retail, you have to be able to do compliance packaging, like Leanne talked about. You have to be able to do delivery to the patient. You have to be able to provide 24/7 coverage, all hours of the night, of a pharmacist being able to answer the phone and potentially getting a drug there. There's services available for pharmacists to take advantage of, or they can have their own staff take those calls, but they have to be able to provide services 24/7. So if somebody's got an antibiotic and the doctor wants to start it at midnight, you got to be able to get it to them, period. And then the second piece that a lot of people have problems with is you have to be able to have the capacity to provide IV medications. So what does that mean? Doesn't mean you have to do it yourself. You don't have to put a hood in a clean room in your pharmacy.
Right.
But you have to be able to subcontract with someone. And usually in a small town, going to your local hospital is probably the best place to go, because they're already making IVs and setting up a subcontract that if you get an order, you got somebody that can fill it.
Right.
Or you could go to a home infusion company or home infusion pharmacy and get those subcontracts done.
But you'd still have to be responsible for the delivery piece of it.
Correct.
Yeah.
Correct. Or you could have the pharmacy deliver it, but you have to be sure that that patient receives that product that they need when they need it. We're talking to people already in the business. That doesn't happen very often. It does occasionally. A lot of times it's coordinated with a home health care agency and they're already taking care of it. You just have to be aware of what's going on and how to do it and make sure you're taking care of it. Those are probably the two biggest ones that we really get questions on. The other ones are things like inventory, that you have different types of inventory, like liquid products or products that can be crushed, because you've got patients that may not be able to take oral tablets or capsules. So you have to have the capability of having all of those in stock, and in stock right away. You can't wait. You can't order it tomorrow and get it the next day. You got to get it to the patient within 24 hours. So those are the type of things I think that are probably the biggest issues out there. Policies and procedures, that's a big thing. I had a lot of questions recently about that. Well, what do you mean about a policy and procedure in a patient's home? Well, you have a sheet that has how do you get a hold of the pharmacy? Right. What do you do if you have a new order? All those type of things are important. So it's kind of a policy, but it's not necessarily like when you would write for the pharmacy.
Yeah, and I think a lot of times pharmacists hear policies and procedures and they get a little bit, oh my goodness. But really, a policy and procedure, when you break it down, is literally just a documentation that shows this is how I do things in my pharmacy. It should almost be a training manual for when you're bringing on a pharmacist. This is how we do things at XYZ Pharmacy. This is how we care for our pharmacy care at home patients.
Yeah. So have you both seen an increase in interest on the part of
Yes.
independent pharmacies to
Yes.
get involved in
I
this
think the message
space?
is getting out there. I think the message is getting out there. And I think one of the things that is also resonating with pharmacists, I know it resonated with me. You know, I graduated in 1989. I thought we'd be providers by now.
You're a young person.
This class of trade, you are a provider.
Yeah.
You know, you are a
Yes.
provider. And when you look at the Gallup polls of our seniors and coming seniors, over 90% of people want to age in their homes.
Yeah.
So if you really sit down and say, do I want to get into this class of trade with my pharmacy? Yes, it can keep you whole enough where you can generate some extra revenue, but you can also really become the center of healthcare in your community. And I really think, I can't think of a place in the United States where that's not needed at this point.
And I totally agree with that. I do think we have work to do with the PBMs to
Yes.
get them to really understand what these pharmacists are capable of doing and pay them appropriately. There really isn't, the big PBMs are not contracting today, but they have graciously offered some enhanced retail contracting. It's not what we really want to see, but at least they get something that's a little bit better than what they could get if they were filling these as retail prescriptions. So I think that's another hurdle that we have to get through. And then getting paid for the services that you're doing beyond that. So things like medication management, if you're doing a drug regimen review like you do in a nursing home, if you're doing the care coordination where you're literally calling the patient or the caregiver monthly and talking to all the prescribers that are prescribing drugs, because that's the biggest thing you're doing. If you're taking everything and putting it together, you're going to reduce duplication of therapy. You may discontinue drugs. You may offer a better service for that patient than they've ever gotten before because they're seeing 5 different doctors and 2 nurse practitioners. I can see that happening pretty easy.
And deep prescribing. You know, patients have to come in with 3 chronic conditions and medications for those conditions. But, you know, we're uniquely qualified to say, hey, this is creating a risk for them to stay at home long term. We need to deprescribe this and make sure we're managing this medication appropriately to keep them safe in their homes.
Yeah, I would imagine that that's a big part of it.
It is a big part of it. It is a big part of it because some of these people, and Susan has done this as a consultant pharmacist, they come in with 10 or 12 medications and they're 3 medications that are treating symptoms of another medication. And someone has to be the expert to say, we've got to reduce this medication load so this patient doesn't end up hospitalized. And pharmacies are really uniquely qualified to do that. And I would also add, in terms of, so the improved molecule reimbursement is something I know Susan and GeriMed have fought for. I'd say she's probably way out in front in the universe. At CPESN, there are already billable clinical services opportunities in this care in Texas. You can bill a code for that patient assessment, that initial onboarding on the medical side and get reimbursed for that. And we're working every day to try to create pathways to payment for the clinical services that we all were educated to be able to perform for these patients. So I think the future of this is incredibly bright.
This is a great opportunity for an independent pharmacy, but the question I have is, as we get into this and develop this model for our pharmacy, how deep into the care of the patient are we going? How do we coordinate all these different caregivers and other ancillary help? And, you know, do you provide that guidance and assistance to help pharmacies put together their network to help the patients?
Yep, we sure do.
That's why we need both of us.
Exactly.
That's the important piece that CPESN can offer to these pharmacies is to help them with that because they have to be doing that piece of it or it's not going to work.
Exactly.
Because if you have one drug that for some reason, you know, the daughter goes and gets it from a local retail pharmacy and you're prescribing all the rest of them, you could easily have a duplicate therapy.
Yeah.
The one doctor did the same exact therapeutic class of drug as what they were already taking. So that's extremely important to coordinate all that. Otherwise, you're not doing what this whole program was meant to
Yeah.
be.
So care coordination is a
Care
key.
is an integral
coordination
part.
and a collaboration with other providers. We've got some pharmacies that are being hugely successful with community health workers because they're already attached to all the organizations providing the assistance for the activities of daily living. So there's a huge opportunity here, and I am so, you can tell,
Yeah.
I'm just about ready to bounce in my chair, and I'm so excited.
I'm just going to bounce a concept out, and I don't know if we have enough time to go deep, but there is a movement in pharmacy for healthcare advocates, pharmacists as healthcare advocates. It's taking the community health worker as a technician, and now in going up a level to a pharmacist and enhancing service where they can really be part of the pharmacy and coordinate all these activities. And their primary role is to make sure this all works.
Yeah, and I think, I think you really just actually described, if I could wave my unicorn wand, you just described what I think this is going to look like in 3 to 5 years. So you've hit the nail on the head.
All right.
Friend.
Okay. We'll talk some more.
Okay,
Yeah.
all right.
Well, ladies, I really appreciate you being. I think it's great that you all came together and you contributed greatly to our podcast. And I'll be the first to admit I do not or did not know a lot about LTC pharmacy at home, and you've certainly broadened my knowledge, and I'm sure you provided some great insights to our listeners. So thank you again for being on today.